Our fifth cyanotic heart disease is tricuspid atresia. So you can get a lot of information just from the name. The tricuspid valve is atretic, or it's gone. So there's no tricuspid valve. Let's see what would happen as a result of this. So you have an absent tricuspid valve, and in addition you have right ventricular hypoplasia. So we'll talk about what this means. So we have a absent tricuspid valve and a hypoplastic but not lost right ventricle. So right ventricle is a lot smaller than normal and cannot handle as much blood or pressure. So this will play a major role in the pathophysiology and the symptoms associated with this condition. Because the right ventricle is so damaged and the tricuspid valve cannot open and the right atrium cannot pump blood to the right ventricle, the only place for the blood to go is to the left and then go back to the right to become oxygenated. So you need to have an associated abnormality such as an ASD, VSD, PDA to allow for mixing of blood to help the infant survive. Unfortunately, though, some patients may have a pulmonic stenosis, and that will restrict pulmonary blood flow even further, and the cyanosis will be worse. So let's look at all these on this diagram. So if we did not have a ASD or VSD or PDA, there would be no way for blood to go from the right side of the heart into the lungs. Reason why is that there's no tricuspid valve, right? So it has to go from the right atrium to the left atrium, then to the left ventricle, and if there was no defect here, it would just go to the aorta and circle around, and you'd never get oxygenated blood. So that's why you need a PDA, ASD, or VSD to mix the blood to allow for blood to go to the right ventricle, which is hypoplastic, go to the pulmonary artery, and get oxygenated by the lungs. All right, and if you have a pulmonic stenosis, that's not good, because you're already having decreased blood flow to the pulmonary artery. A pulmonic stenosis will make there be even less blood going through the pulmonary artery to the lungs, less oxygenation, more cyanosis. So some signs and symptoms of tricuspid atresia. We get cyanosis. Why? We talked about it. Because blood cannot go direct from the right atrium to right ventricle to the lungs and go back to the system on the left side. So what happens is you need to go and mix the deoxygenated and oxygenated blood, and this hypooxygenated blood, or inadequately oxygenated blood, goes both to systemic circulation and to the lungs. You also get heart failure. Why is that? Because the left heart has to deal with all of the load that the right heart can't handle. So because of that, the left heart gets very enlarged and has a high chance of failing. All right, these are the common symptoms you see associated with heart failure because the heart cannot meet the metabolic demands of the body, and it cannot handle the preload of its own pulmonary venous return as well. Left ventricle cannot keep up with the demands of the body because the right ventricle is hypoplastic. Left ventricle has to compensate, and partially oxygenated blood, meaning that it needs to pump harder to meet the tissue demands. Another important symptom is a single S1 heart sound. Remember, the S1 heart sounds are tricuspid and mitral valves. But there's no tricuspid valve, you're only going to have a single S1 heart sound. And it may be accentuated because of high pressures in the left ventricle, snapping the valve shut after diastole is finished. More signs and symptoms of this condition. A murmur from associated defects is very common. Remember, we talked about you need to have associated defects for this condition to be allowed for survival. So you can get a VSD, a holosystolic murmur at the left lower sternal border. You can get a pulmonic stenosis. We talked about how that can be associated and worsen the cyanosis. We can have a mitral flow murmur because of excessive blood on the left side of the heart and going through the mitral valve. And a PDA to mix the left and right circulations distal to the pulmonic stenosis if there is one. And this will cause a continuous machinery murmur during systole and diastole. A PDA is the only murmur that occurs during systole and diastole. So if you see this kind of murmur, it's probably a PDA. Next, because this tricuspid atresia can cause chronic heart failure and chronic cyanosis, if you have long-term cyanosis with this condition, or actually any of the conditions, if it's longer than 6 months, you can get clubbing of the nail and the digit. So normally, if you look at your finger, you can see you have right here and right here. This is the proximal nail fold, and this is the cuticle. There should be an angle where it goes down into a little valley and then goes back up. So this depression should be present. But the red line indicates what would happen if you have clubbing. And you'll have a much flatter region, and that's why your finger looks like a little club. So important to know. Alright, clubbing means loss of the angle between the proximal nail fold and the cuticle. So now diagnosis. How are we going to diagnose this condition? Remember, we talked about stabilization of the patient first, then chest x-ray and EKG. Remember, in this condition, unlike most of the others, the left side is the one that's very large. And the right atrium will be enlarged as well because of the excessive blood flow going back to the right atrium. from the lungs, and you have decreased pulmonary vascular markings. Okay, why decreased pulmonary vascular markings? Because you have less blood flowing through the pulmonary artery into the lungs. You'll have decreased vascular markings on the x-ray. And I apologize about the right atrial enlargement. The reason why it's enlarged is not because the increased pulmonary blood flow. There's actually decreased pulmonary blood flow. The reason it's enlarged is because it can't pump through the tricuspid valve, and it's to pump across into the left atrium. So the reason for right atrial enlargement, is because it has to pump across the ASD into the left side, left atrium. EKG shows left-sided problems, as we've discussed, and the definitive diagnosis is done by echocardiography. Treatment: you need to give a prostaglandin E1 infusion to severely cyanotic neonates. Why is that? Because a PDA will allow for more blood to enter the pulmonary artery from the aorta, and since you have decreased pulmonary vascular markings, you need more pulmonary blood flow for survival, and prostaglandin E1 will be helpful. And most neonates, despite cyanosis, are well compensated for the first weeks of life. So even though they have tricuspid atresia and some cyanosis, there's enough blood going to the lungs and to the body to support them, even though they'll be having some heart failure symptoms and having some hypoxia and cyanosis. If the patient is severely cyanotic and hypoxic, PG1 is helpful in that situation. But overall, the treatment is surgical repair. You can't keep a neonate who's cyanosis, even though they're well compensated in this tricuspid atresia state. You've got to treat it and do some kind of surgery, and surgical repair is a definitive management for this patient.